Hello everyone, welcome back to my YouTube channel, Mid Code Education. So, good afternoon, all of you. Let us start our class. Today, I'm giving you about CPT textbook. Okay, current procedural terminology related. What is CPT and what are the procedures inside the textbook? What are the special codes inside the textbook? Okay, everything is detailedly explaining in this video. So I hope this video is very helpful for all medical coding students. Okay, so let's start our class. First of all, what is CPT? CPT means current procedural terminology. This is the full form of CPT. Mostly in medical coding interviews, they have asking about the short form also and long form of the particular words. Okay, so uh, you have a basic knowledge in CPT, CPC, ICD, HCPCS. Okay, everything will be everything's short forms you have to understand. Okay, current procedural terminology. Mm, okay, so basic related to a CPT textbook is first one copyrighted and maintained by AMA. Okay, so it's a American Medical Associations maintained. Okay, maintenance is handled by AMA. Used with other sets to report healthcare services performed in the US. Hmm? Okay, US, it completely related to US healthcare. And the process of converting medically necessary services or procedure for disease condition is called CPT coding. What is CPT coding? Okay. Uh, Inside the textbook, CPT contains a lot of medical procedures or services. So, this textbook is helpful to converting all the medical procedures or services into particular CPT coding. Okay, clear. So, it's a converting process. And next is related to procedures services inside the textbook. First of all, in CPT, current procedural terminology contains four basic services. First one, medical services. Second one, surgical services. Third one, diagnostic services. And fourth one, screening services. Clear? So in medical services, it contains injections, PT, counseling, etc. Okay, so this services is called medical services. And next one is surgical services. Surgical means surgery related things. Okay, so appendectomy. Appendectomy means it's a surgery for appendicitis. Clear? So it's a procedure. And cesarean delivery. Everyone know about that. What is cesarean delivery? Okay, it's a operation. Okay, operation. Um, for a pregnant ladies. Okay, so appendectomy, cesarean delivery, etc., is considered as the surgical services. Okay, and next is diagnostic services. Diagnostic means X-ray, CT, MRI. Okay, so this type of services is called diagnostic. And last one, it is screening services. Screening means checkup. Okay, simply we can say that screening means checkup is for annual checkup, wellness visit, etc. Okay, so overall body checkup is considered as a screening services. Clear? And our textbook, CPT books are classified into two main sections. First of all, tabular list and alphabetic index. Clear? So in tabular list, um, you know, contains three categories also. Okay, three categories means category 1, category 2, and category 3. First of all, category 1 contains some CPT codes. Okay, category 1 is again divided into six main sections. Okay, six main sections. The six main sections in our you can just open your textbook. You have to see that evaluation and management is the first section of CPT textbook, and anesthesia is there, surgery is there, radiology, pathology, and laboratory medicine. These are the main six section titles inside the textbook. Clear? Evaluation and management is the code range between 99202 to 99499. Okay, it's a 99K series. Clear. And next is anesthesia related. It is 001002 01999. This is the code range between anesthesia. And next is surgery. Surgery related, it means it's a huge one. Okay, it contains uh, too much codes. 100212 69990. Okay, and next is radiology. In radiology, it contains 7001002 79999. Clear. And mostly radiology session codes contain CT, ultrasound guidance related. Okay, diagnostic type of services included in the radiology. Okay, the surgery contains some surgery related things, appendectomy, cesarean delivery, etc., etc. Anesthesia it is related to a sedation type related. Okay, before the surgery, physician put the patient into anesthesia. Okay, the physician give a patient anesthesia. So this type of codes are included in the anesthesia section. And next is pathology and laboratory contains some lab tests and some little bit conditions of a particular disorders related things. Okay, completely it's a laboratory. I mean blood test, urine test, etc. The code range between 800472 89398. Okay, then medicine. Medicine, it's a type of medicines included 902812 99607. Okay, clear. Category 2. Category 2, CPT code contains alphanumeric format with the letter F in the last position. Okay, for example, 0001F. Okay, so this is a category 2 CPT codes. Category 3 contains temporary codes, last T, okay, in the position last T alphanumeric structure. And how to find CPT codes? How to find CPT codes based on below criteria? First of all, what is the procedure? This is the first section. Second one, where it was done, anatomical site. Okay, where it was done. And third one, how it was done. How it was done, method of procedure, open or closed. So these are the main three things wanted to find a particular CPT codes. Understand the procedure, and second one is anatomical site and method. Okay, how it was done or a method of the procedure. It is an open procedure or closed procedure, whatever the procedure was. So identify the method of procedure. Clear. Here are some examples. uh, Try to take the code of this particular things. First one, anesthesia for cesarean delivery. It's a direct question. So here the procedure done, anesthesia. Clear. And where it was done, anatomical side. It's a cesarean delivery. So it's a stomach related thing. And how it was done, method of procedure. It's a cesarean delivery. Clear. And also strapping of hip, ligation of inferior vena cava, percutaneous needle, liver biopsy, simple cystometrogram, incision and drainage of lacrimal gland, X-ray of partial mandible tree views, thyroid stimulating hormone test, intramuscular injection. So these are some examples. And next is it is very important in your CPC examination. Types of CPT codes. Okay, it is very very important because in the coding guidelines or other questions they have asking continuously this type of questions. Types of CPT codes are classified into three types. Okay, first one standalone codes, and second one intended codes. Third one add-on codes. Clear? Standalone codes, indent codes, add-on codes. And let us check one by one. First one, standalone codes. Standalone codes means standalone codes are CPT codes that provide full description of procedures and services. Okay, that provide full description and procedures. So this type of codes are called standalone codes, complete procedure and complete services provided by this type of codes. And second one, intent codes. Intent code means if a procedure is intended below another code, the intended procedure is an important variation of a above procedure and could replace the first code. Okay, so the description which comes before the semicolon is the general procedure. The phrase that comes after the semicolon is additional specific informations. Okay, Indian codes, Indian code it's a indented below another code. Clear? One code is there and indented below another code is called indent codes. Okay, so mm, mm, the important variation of a above procedure could replace the first code. Okay, which comes before the semicolon. In your textbook or take any code, you can see that semicolon is put before the description. Okay, so this is the general procedure. And the phrase that comes after the semicolon is additional specific information. This type of codes are called intended codes. And add-on codes. Add-on code is very easy to identify because in the code, in front of this code, there is a symbol. Plus symbol is there. So this type of codes are called add-on codes. Okay. Describe a service always performed in conjunction with the primary service or procedures. An add-on code is eligible for payment only if it is reported with the appropriate primary procedure by the same physician. Add-on codes are never reported alone. Okay, it's an add-on code, not never reported alone. First of all, you have to report the main code. Only after that, you have to add the add-on code. Clear? In the CPT manual, an add-on code is designated by the simple plus. Okay, so it's very easy to understand and easy to um, identify. Clear? Yes. So this is enough for today, guys. This is the common basic things related to CPT textbook. I hope this video is very helpful for all medical coding students who are ready to attending the medical coding exam or trying to studying the medical coding. So I will be back on next video with more content, more chapters, more questions. Okay. See you guys. Thank